You've probably heard the term buck teeth 1,000 times, right? But it's one of those things that comes with a ton of questions. So, in this quick explainer, we're going to get past the nickname, understand what's really going on, and check out the modern ways to fix it. We'll even map out what that journey to a new smile actually looks like.
It's a phrase we all know, but what does it actually mean from a dental perspective? And beyond just how it looks, is it something you really need to be worried about? Let's find out.
And the short answer is, yeah, absolutely. While sure, appearance is a huge reason people seek treatment, having protruding upper teeth can cause real functional problems. We're talking about things that can affect everything from your speech to how you chew your food.
All right. So to really get a handle on the treatment, we first have to get past the slang. Let's take a look at what's actually happening from a clinical point of view.
Okay, so here's the official term. Your orthodontist would use Overjet. It's not a super complicated idea. It just means that the upper front teeth stick out or protrude way past the lower ones. So when we're talking about a solution, what we're really talking about is correcting this overjet.
So how does an overjet even happen? Well, it's usually a mix of nature and, nurture. Genetics plays a huge part in the size and shape of your jaw. Thanks, Mom and Dad. But childhood habits can also be a major factor. Things like long-term thumb sucking or even just the way your tongue pushes against your teeth can gradually nudge them out of alignment.
And this isn't just about looks. Not at all. There are some real risks here. Teeth that stick out are just more exposed, right? That makes them way more vulnerable to getting chipped or even fractured in an accident. Plus, it can lead to speech issues, trouble biting into food, and for a lot of people, it can really take a toll on their self-confidence.
The good news is there are proven fantastic solutions. For literally decades, traditional braces were the gold standard. But now, clear aligners have shown up as this really powerful alternative. So how do you decide between them? How do they stack up?
The choice really depends on your specific case. On one hand, traditional braces are still the absolute best tool for really complex skeletal problems that need a lot of force. But for most mild to moderate cases, clear aligners have some amazing benefits. They're practically invisible, and you can take them out, which makes brushing and flossing so much easier.
So let's zoom in on that modern approach. How can a simple-looking piece of plastic be so precise at moving teeth? Well, the mechanics behind it are actually pretty sophisticated. Think of it like a three-part system, all working as a team. First, the aligner itself applies this gentle but very controlled pressure. Then, to make that pressure work even better, an orthodontist might put these tiny, tooth-colored bumps on your teeth called attachments. They act like little handles for the aligner to grip. And finally, for the big picture changes, you'll often use elastics to help guide your entire bite into the right spot.
And the cool thing is, the progress is all mapped out in phases. The first few months are all about making space and getting that initial alignment started. Then, by the halfway point, you should see a really clear, noticeable improvement in the overjet. The final stage is all about the little details, fine-tuning the bite and perfecting that final result.
So, what does that whole journey add up to? Well, from most mild to moderate cases, you're looking at a total treatment time somewhere in the range of 12 to 18 months. Now, I know that sounds like a commitment, but it's a totally finite process with a very clear and predictable finish line.
Okay, so we've covered the science and the timeline, but what about the practical stuff? What's it actually like living with clear aligners day to day?
If there is one number you absolutely have to remember during treatment, it's this one. For the aligners to do their job properly, they have got to be in your mouth for 20 to 22 hours a day. That leaves you a small 2-hour window for eating and cleaning. Anything less than that, and you really risk slowing down your progress. Consistency is everything here.
Your daily routine gets a simple but really important update. The rules are firm. Aligners only come out when you eat or drink anything other than water. As soon as you're done, you gotta brush your teeth and pop them right back in. And of course, you'll also give the aligners a quick clean every day to keep them fresh and crystal clear.
We've talked about the how, but now we need to talk about the who. This is so important. Not all aligner treatments are the same, and choosing the right path is absolutely critical for your health and safety.
First up, always look for those official stamps of quality. In the US, for instance, any reputable aligner system is going to be FDA approved. That means it's been seriously vetted to meet high safety and effectiveness standards.
And that's true on a national level too. So, for example, here in Pakistan, you'd look for an approval from DRAP, the Drug Regulatory Authority. These certifications just give you that extra layer of confidence that the product is regulated and totally safe to use.
But honestly, above all else, please remember this. Your treatment should always be supervised by a qualified orthodontist. Moving teeth is a complex medical procedure, not a DIY project. Those unsupervised mail-order kits can come with huge risks, while having a professional in charge ensures your treatment is safe, effective, and actually designed for you.
You know, this quote really just captures the whole point perfectly. Correcting an overjet is so much more than cosmetic. It's a real investment in your long-term oral health, your daily comfort, and of course, your confidence for years and years to come.
So, there you have it. We've seen the causes, the risks, and the clear path to a solution. The technology is out there, the expertise is out there. It's definitely a personal journey, but it's one where modern dentistry has made a healthy, confident smile more achievable than ever before.